My name is Julie Dennis. I am a menopause in the workplace specialist, and I partner with organisations across the UK to help create positive behaviours and conversations around menopause. So what we're going to talk about today is giving you an overview of what menopause is, the common challenges that people experience going through menopause. I'm going to talk you through the business case so you understand why it does matter in the workplace, and share some strategies for promoting an inclusive menopause environment, including how to initiate a conversation with a team member who you think might be struggling because of menopause. What I don't want really is for me to just be talking at you for the next hour. So if you have anything to say, if you have any questions or comments or anything you would like to share at any point, then please feel free to speak up. And in fact, actually what I'm going to do is start with a question for you. Don't worry, it's nothing difficult, so don't panic. Just trying to get a sense of how everybody is feeling in the room this morning. So what I'd love you to do is just share a couple of words about how you feel about menopause, whether you're feeling uninformed or uneducated or hot or cross or tired or anxious or maybe quite comfortable and confident about the topic. So if you just want to give me a couple of words from this front table here.
Exhausted.
Yeah.
And looking, quite excited to see what.
Good combination of ease there, exhausted and excited. I like that. Thank you. Any others from that table?
When this thing started, I felt very anxious and angry and that. But I'm very determined to beat it.
Yeah.
And I'm actually I've got my girls.
You got your buddies with you. And that's all. Yeah, and that, you know, that thing that menopause can be a very lonely place, whether you're experiencing it yourself or you're trying to manage it at work or socially, which is ridiculous considering the amount of people who are going to go through it and be impacted by it. So, you know, getting people in a room together, talking about it, sharing experiences is immensely beneficial.
I'm the professional lead nurse in Croydon for general practice, and we're going to be looking at having some menopause champions.
Fantastic.
So I've get myself, having gone through the menopause,
Yeah.
and thank God for HRT, or we would have been mad. Without a doubt.
And we will touch on HRT later today. Yeah, menopause champions are becoming increasingly popular in the workplace. I do a lot of training for many menopause champion networks, and they can really help to keep the topic lively, relevant, and front of mind, and take the pressure off HR a little bit as well, actually.
I'm going through it. I may say that I'm informed, but my cup is not full.
Yeah, you can. There's always more to learn.
Yes.
Gotcha. Thank you. Lady at the back.
Fairly well informed. Fed up with it.
Yeah.
And tired.
Tired. Yeah. I hear that a lot as well. Thank you. Table of ladies, trio there.
So 8 years through,
Uh-huh.
managed without HRT,
Mhm.
like I've been washed up, kind of up on another shore.
Yeah.
But quite happily.
Mhm.
Looking back, I'm in the incongruous position of having a 11-year-old, and being 55. So I kind of went straight from late life motherhood, probably into the perimenopause.
Sure.
So I've got a lot of I'm a nurse, I'm an occupational health nurse manager, but a lot of my nursing buddies, each other since we're 18, they're still some way on that kind of, you know, still
On the hormone trail, yeah.
On that. So I suppose I went through it fairly early at 47, my last cycle, and so have parties to conversations about people's experiences. All I can say is I suppose I got through it, and I feel like I'm washed up. But okay. But looking back, thinking the insomnia, the anxiety, energy is different.
Yes.
Definitely. I feel like I'm on a different shore. I'm in a different stage of life.
Yeah, and I think, you know, one of the things I get asked quite a lot, especially when I'm running sessions for people experiencing symptoms, is will I ever feel like myself again? And I think the answer to that is no, but that's not necessarily a bad thing. Because, you know, in your 30s, you don't feel like you did in your 20s, you know, thank God. You know, and 40s are different to 30s. And as we grow older and we have more experiences and challenges, we grow and we change. And that's okay, isn't it?
Yeah, so different landscape.
Mm-hmm.
When you look back thinking, was it only 10 years ago, that I was breastfeeding,
Yeah.
I'm thinking, it feels like I should be a grandmother, but I'm still, I'm still working, but then thinking, what is the next stage,
Okay.
So I feel I start myself somewhere between middle age and old age. Yeah.
Thank you.
Yeah.
Ladies, how are you feeling about menopause?
I just think how everyone is so different,
Mm-hmm.
what they experience.
Very true. Yeah.
And I can say my mother-in-law, for example, so I lost my mother very young, so she never went through the menopause, so I couldn't ask her, but she had one day of not feeling great.
Mm-hmm.
That's it.
Your mother-in-law.
My mother-in-law, yes. And that's it. It's about people being tolerant.
Yeah.
Because you find that some people aren't so tolerant.
Yeah, I was fine. I powered on through. Why is everybody else making such a fuss about it? And that can create difficulties in the workplace, challenges. And that's why it's really important we educate everybody about menopause, not just those directly impacted by it. Yeah.
I think that also from colleagues, I think it's men need to be informed because they may be not sleeping next to a partner who's kicking the sheets off and sweating, and anything.
Absolutely. If you're sharing a bed with someone who's not sleeping, you're probably not sleeping either. And that's going to have an impact on your relationship at home and potentially your performance at work as well, because we know what happens at home spills into the workplace, however much we try to hold it at bay. Yeah.
So menopause chat, sounds.
And we're running a menopause and men session in August. So, and we've got quite a few signed up. What date is it?
5th of August.
5th of August, a little promo there for all your male colleagues. Get them down here. Anything you'd like to add?
No, just that I'm wanting to be better informed about it.
Yeah. Okay, great. Thank you. To the table at the front here, what would you like to say about menopause? What does it mean to you right now?
I'm not there yet.
Mm-hmm.
But I've seen friends.
Yeah.
They go about with ice water when it was winter.
Yeah.
So they behave irrational or something like that.
Uh-huh.
So I'm just here to have hold of it.
Yeah.
Something like that.
Pick up some information, get educated, so you're well prepared. Brilliant.
Yes.
Hi.
So haven't encountered it as yet, but I'm sure it's coming very soon. But in terms of my role at work, just very cognizant of the fact that it impacts staff in many ways, and just looking to being able to support staff in the best way possible.
Yeah, brilliant. Thank you very much. Okay, thank you very much for sharing, everybody. Wasn't too bad, was it? It's always terrifying when somebody says you're going to have to interact, but I promise you it's all very relaxed and easy. Okay, so why do we even need to talk about menopause at work? Sorry, I should have been. So if we move on to the business case slide. So there's a couple more forward, that's it. So there's 3 specific reasons why we want to be talking about menopause at work around risk, retention, and reputation. So first of all, from a risk perspective, whilst there's currently no specific legislation in place to protect people working through menopause, there is general protection under the Equality Act. Now, yes?
Will notes be provided, or do we need to?
I have got some resources that I will share afterwards through Anthony that can then distribute amongst you. Yeah. So what was I saying? So the Equality Act, there are 9 protected characteristics, as you're probably aware, under the Equality Act, and 3 of those are relevant to menopause: age, sex, and disability. Now, you might not be surprised about age and sex, but what about disability? Well, what the law is not saying is that menopause is a disability in itself, but what it is saying is that it meets the definition under the Equality Act. In other words, the impact symptoms can have on day-to-day activities over a long period of time, over 12 months, meets the definition of disability under the Equality Act. We've seen employment tribunals related to menopause triple over the last 3 or 4 years, and disability is coming up more and more as, that's the basis that employment tribunals are being brought on.
Tripled over the last how long?
It's 3 or 4 years. I think it's 3. It's my brain fog. I'll come on to that later. But they're going up. So there's still a very small percentage of overall employment tribunals, but they are increasing. And from conversations that I've had with employment lawyers, we're seeing settlement cases go up too. So they're not actually making the courts, because obviously that's not what employers want. So they're doing a deal before it reaches the court.
Would you say that is that the menopause itself, or like because somebody has a condition like anxiety, which may be related to the menopause?
It'll be to do with the symptoms of menopause. So we'll look at the symptoms of menopause shortly and the impact that they do have on people's challenges. So it's the symptoms of menopause, how that's affected their ability to do their job, and then how their workplace wasn't supporting them, essentially.
So has anyone gone to court, or has it all been settled?
No, we've seen, I think it's 50 plus employment tribunals to date.
A case? Can you give us a case?
Yep, so what have we had? So the very first one was BT back in 2012. Since then, we've had Bon Marche. You remember the clothes shop? Yep. So Bon Marche. There was I can't remember the. It was a pet store. They provide pet food, and basically the manager had shouted out, "Oh, you're on your menopause," because somebody was, struggling at work. So it's that kind of thing.
Are you sure? Yeah, that wouldn't be to do with gender though, like being,
No, so there is age, sex, or disability. So there's 3 protected characteristics, and in different cases, different characteristics have been used. So the one that was used in the Scottish Courts and Tribunal Services back in 2018, that was disability. She'd suffered a lot from a lot of anxiety and brain fog. The other thing to be aware of is there is the House of Commons Women's and Equality Committee are currently undergoing an investigation into whether there is currently enough support in the workplace for people working through menopause. The findings were supposed to come out this spring, but I guess they've all kind of been distracted by other things. But one of the things that employment lawyers are telling me that we may see is in menopause becoming a protected characteristic in its own right. So look out for that. So that's the risk piece. Is everybody happy with that? Yeah? From a retention perspective, people working through menopause are often at the peak of their career. Yet, despite that, we know that 44%, around 44%, say that their ability to do their job has been impacted by symptoms. 14% have reduced their working hours because of symptoms, and around 10% have actually left the workforce. And as Anthony said at the start, the last thing we want to do is lose even more valuable, talented, experienced employees to menopause, when actually it's pretty straightforward to get them back on track, put adjustments in place if necessary, and keep them within your organisation. And the third piece around reputation, when you're working in an environment where it's okay to talk about sensitive topics like menopause and it's easy to access support, you are enhancing feelings of inclusion and belonging, and you're setting yourself apart as an employer of choice. So those are your 3 reasons: risk, retention, and reputation. Is everybody happy with those? Yeah? Okay, good. Next slide. Oh, you did? Well done. Okay, so let's look at what menopause is now. So the term menopause is a catch-all phrase for any time that you might be experiencing symptoms. But what it technically means is when your periods stop. Meno bleeding, pause to stop. So it's when you have your final period. However, because you don't know at the time that it's your final period, menopause is defined as 12 months after that date. So once you've been for 12 months without a period, you're then officially in menopause. Now, the average age for that to happen is 51. However, 1 in 100 people under the age of 40 will experience an early menopause, and 1 in 1,000 under the age of 30. And that can be because their body reaches menopause early, but naturally, but much earlier than we'd normally expect, or it could be as a result of medical intervention. So surgery, like a hysterectomy, for example, which was my experience in my early 30s. Medical treatment, like chemotherapy, can trigger an early menopause. And people going through IVF are often put into a forced menopause for 2 or 3 months as part of that treatment. It's important to recognise that menopause can affect trans colleagues as well, particularly thinking about trans men who may still have womb and ovaries intact. And in fact, I ran a session a while back where we had a trans woman joined us, and she talked about the fact that as her hormone levels started to change and she experienced sort of pseudo-menopause symptoms really, it felt like her body had finally caught up with what her mind had known all along. The other thing that you might be interested to know is that men undergoing treatment for prostate cancer can experience menopause-like symptoms, particularly the disrupted sleep and the night sweats. Yeah.
for many years, and I had one client who had to wear uniform,
Mm-hmm.
and I ordered him double supply of cotton fibre shirts, so you have 14 shirts rather than 5 or whatever.
Because of the sweats.
Yeah.
Yeah.
They came from Sri Lanka. They took like 3 months to order. So, but yeah, and actually just talking about, because he was going through very similar symptoms to a woman, you know.
Absolutely.
Menopause,
So, you know, whilst we have this image of menopause being something that affects women of a certain age, and, you know, any article you read about menopause, it's always got a middle-aged woman fanning herself, you know, as the headline. And we really need to change that narrative, because menopause can affect people of all ages and all identities. And that's what you should be thinking about at work as well, especially. You know, particularly if you're looking at policy and guidance and things like that, you know, think much broader than the kind of the typical middle-aged woman. Now, after that one day of menopause, you're officially post-menopause. And while symptoms should start to fade, usually they hang around for approximately another 4 to 5 years. Time leading up to menopause is known as perimenopause, which is when hormone levels first begin to change. The key ones at play are estrogen and progesterone, and actually they're fluctuating and going downwards as opposed to just a sharp drop. And of course the changes in those hormones have all kinds of knock-on effects with other hormones and the way that your body reacts. And perimenopause usually starts around 4 to 5 years before the date of that final period. On average, people notice symptoms for 4 to 8 years. So up to a quarter of somebody's working life. Another really good reason, I think, why we need to be talking about this in the workplace. Symptoms of menopause. Next slide. If you had to name a symptom, what would it be? Just shout one out.
Insomnia.
Yep. What else?
Sweat.
Sweats, yeah. Insomnia, sweats.
Irritability.
Yep.
Anger.
Anger, yeah. The menopausal rage. I saw this play about, it would have been before COVID, so 3 years ago. It was a bit odd, but it was about these 3 different menopausal people, and they're all dragging around these suitcases, and these wheelie suitcases were kind of representative of their rage, and when they opened the suitcases, you know, the rage kind of exploded. Any others?
Anxiety.
Yes. Anything else?
Libido.
Yeah.
Mm-hmm. Yep, makes it very difficult in relationships, or if you're trying to start a new relationship.
Yeah, intimate discomfort, vaginal, you know.
Yep.
Yes, and urinary tract infection.
Yep, UTIs, very common, not talked about very much. Let's have a look at the next slide.
Bleeding, like irregular bleeding, heavy bleeding.
Yep.
Just,
So here's a few more. So there's about 34 officially listed. You know, this isn't a finite list by any means. But, you know, anecdotally, we hear about a lot of others.
What about constantly hungry all the time?
Yeah, so your hunger hormones, ghrelin and, I can't remember what the other one's called. 2 hunger hormones, ghrelin and, no, it'll come back to me. But they get impacted, so your body gets confused as to whether you're still hungry or you've eaten enough. Sorry?
Incontinence?
Yep, so pelvic floor changes. Yeah, pelvic floor changes, and as estrogen levels reduce, the skin can become a lot drier, a lot thinner, changes around the urethra.
hair, brittle, yeah, I can only say
Yep.
like brittle and kind of,
Hair loss, brittle nails, itchy skin.
what's the itchy skin about? Is that about?
So again, that's estrogen levels. So amongst its other many roles, estrogen is a moisture-giving hormone. So as the levels start to drop, your skin can become a lot drier and thinner and itchier. Whenever I start talking about it, I start itching. So I'm going to stop. Yeah.
So what's the burning tongue one?
So people talk about a burning tongue sensation, which is very odd, or very dry mouth, again to do with those changing estrogen levels. I mean, hot flushes obviously is the one that we hear talked about all the time, right? Is it hot in here? Is it me? Ha ha ha. So anyone ever had a hot flush? Yeah? Not really that funny, are they? A lot of the time. No? And again, not everybody has hot flushes. For those of you who haven't had a hot flush or who may never have a hot flush, just to give you an idea of the kind of the power, I was running a session once and one of the attendees was talking about her hot flushes. And as she was talking about it, she started to have one, which isn't unusual. And she had her glasses perched on the top of her head and they steamed up. And, you know, when it's happening, all you can think about is, oh my God, how am I going to cool down? Can anyone else tell how comfortable I am? Am I going red and blotchy? Am I physically perspiring? Had another delegate once who talked about the fact she worked at a fancy lawyer's in London, and by the time she'd done her commute each morning, she was drenched through. So having got ready for work and travelled into work, she then had to start that process all over again, had to take a change of clothes with her, you know, have a shower, get changed and be at her desk. So not funny, really distracting. The insomnia, the lack of sleep. Anyone struggling with sleep at all? Yeah, so, you know, that can be difficulty falling asleep, or maybe waking up through the night every 90 minutes or so because you think you need to pee again, or worrying about stuff that you can't possibly resolve at 3 o'clock or 4 o'clock or 5 o'clock in the morning. So, and again, sleep is quite easy to empathise with because everybody in the room will have had a bad night's sleep at some point for whatever reason. And you know how that makes you feel the next day, how difficult it is to concentrate, to think strategically, to react calmly, to be patient, to be kind, and to be that best version of yourself. So, you know, what's it like when you haven't slept for 6 weeks, 6 months, a year, or even longer, 2 years, and what that does to your cognitive abilities? What else do we have? Well, the rage that we talked about earlier, this menopausal rage. So again, for those of you not in menopause, if you cast your mind back to puberty and you remember emotions are all over the place, anger, tears, very difficult to control. And we give teenagers some slack, don't we? You know, we give them, accept that some of their behaviour isn't completely within their control. Is she? Yeah, you want to grab her and give her a good shake. And you can get that, you know, teenagers in the house and you know, menopausal parent making it very difficult. But with the rage, you know, as an adult, it's not okay to stomp around, slam doors and flick your hair, is it? Especially not at work. But that's how menopause can make you feel, you know, this absolute fury, completely out of proportion to the situation in hand. So I was speaking at a conference a couple of years ago. Must have been during COVID sometime because it was online, it was a virtual one. And one of the other speakers, really senior woman in financial services, sharing her story, which is the fastest way to accelerate awareness, by the way, within an organisation, sharing stories. And she talked about her rage. And she talked about this one time she'd got to work and she worked on the 12th floor and she waited ages for the lift. And it finally arrived and 2 people pushed in front of her. And she was infuriated. So she stepped in behind them and pressed every single button on the lift panel. But then, of course, was forced to remain in the lift with them as they went up and it all became really awkward. So you might think about doing something like that, mightn't you? If somebody pushes in front of you, but you wouldn't act on it. You know, you wouldn't expect an adult to act on that, especially not at work, especially not a member of the C-suite, right? So, you know, it's very difficult to control your emotions. And then the brain fog. Yeah, it is very annoying. Losing your train of thought mid-sentence, getting your words muddled up, can't articulate as well as you have done in the past, reading through emails and realising you've missed a word. Very disconcerting.
I had to deal with dyslexia all my life.
Yeah, and then you have the brain fog on top.
And it's like, what are you doing?
Yeah, I know. And I think that's a really important point because if you are already experiencing challenges for whatever reason, menopause will compound those challenges. Neurodivergence, dyslexia is an excellent example. So you've got your strategies in place to manage your dyslexia, and then brain fog kind of knocks you completely. Is that how it felt?
Yeah, it's very, I get very irritable and then very annoyed at myself. And I work with all men, so, but they're very understanding. And it's like, I know, but...
Yeah, but I should be able to do this. Yeah. But you have these rising levels of anxiety as well. You know, how are people perceiving me now? Second guessing yourself all the time. And then thinking that other people are second guessing you as well and not trusting you as much as they had in the past. So it's a mix of physical and psychological symptoms. There's no one size fits all. It really is a very unique experience. And what we also know is experiences differ within cultures too, although there's a big data gap. But there was a study done in the US recently, a major study that showed that African American women were far more likely to experience hot flushes than Caucasian women. There's one of the leading menopause specialists in the country, Dr. Nigat Araf, talks about how she's seen studies showing that Japanese women are complaining of shoulder stiffness in a way that other cultures aren't, or that Turkish women complain less of hot flushes and more about itchy eyes or blurry vision. So it's a very unique experience. There's no one size fits all. And 1 in 5 people don't have any noticeable symptoms, you know, like your mother-in-law with her one day. So their experience of menopause is very different too, and their thoughts and feelings and behaviours around it, you know, well, I was fine. Why is it such a big thing in the workplace? So in the same way that we educate everyone around mental health, whatever your mental health, the same should be done for menopause. There's a lot of synergy between the two topics.
So it's quite this intersectionality between race and the menopause. It will make things worse.
Yeah, definitely. And if you're already...
Or disability.
Yeah, so in disability, for example, a recent study showed that 22% of disabled people had left the workplace compared to about 10% of able-bodied. So if life is already challenging for you, if you already feel discriminated against, whether that's because of your sexual orientation, your gender, your neurodiversion, your race, your culture, your faith, your economic status, your relationship status, if you already feel discriminated because of those things, menopause is going to compound that. So don't be thinking about people going through menopause, be thinking about people who are also going through menopause. You know, look at everything else that's going on in their life. It's really, really important. I think that's all I wanted to say on the symptoms for now. Anything else anybody wanted to add about these? Okay, next slide, please. So the one thing that we do know about symptoms and work is that it's a two-way street. So your symptoms can affect your ability to do your job as well as you'd like to be able to. And equally, your working environment can impact your symptoms. So for better or for worse, actually. So if you move on to the next slide, there was a study done back in 2018 looking in a bit more depth at this relationship. And these were the top symptoms that came up as affecting people at work. And actually in subsequent studies, and where I've worked with organisations where we've done surveys within that company, these are the ones typically that always come up. Oh, look at that fly. Ooh. These ones typically that always come up top. The fatigue, the flushes, the brain fog, and the anxiety. Now, what this study also looked at was the workplace characteristics that tended to make these symptoms worse. And they're on the next slide. And bearing in mind this was done pre-COVID, and actually it was office-based. But what it did, and what other studies tend to look at too, is on the physical environment, you know, the temperature, the ventilation, noise pollution, access to daylight, etc. And whilst it's worth noting, particularly as managers, that these can have an impact, it's actually really difficult to control these factors, right, isn't it? Wherever you're working, whether you're in an office, on a ward, in another building, or working from your own home. You know, and I remember back in the day when I worked in an open plan office, everybody was bitching about the temperature, where their desk was, who they were next to, whether they could, you know, whether they're near a light or not. So be aware that these things can make a difference, but it's very hard to control it, you know, specifically for, you know, one specific population. It's very difficult to get it right, regardless of your hormonal status. Much better to focus on the culture and the openness and how okay or not it is to talk about menopause and ask for support. Vitamin D, really important for hormonal health. So especially at the moment while we've got a bit of sunshine, if it's safe for you to be in the sun, then try and get outside it for 15 minutes every day and encourage your team to do that too.
I once had this idea, I had a young colleague, Muslim woman, but she obviously wore hijab, and I said, there's nowhere you can actually go and get daylight during the working week and get sun, because you need to have about 20 minutes on your arms and your, you know. So I had this idea of like a sun lounge, which was women, you know, women only, sun lounge, so that Muslim women could, well, dress sufficiently to have their arms, you know, in a female-only environment, so, oh, no, but, you know, I wouldn't want to make a fuss, but yeah.
Yeah.
And that kind of thing, having a, you know,
That's it.
an environment which is...
And thinking about different cultures as well, and how, you know, what's
There's no way you can actually get into a safe space where you feel comfortable to get enough, so you're going to be deficient in vitamin D.
Yes, yeah. But, you know, you can get vitamin D, see your GP, get your levels checked, and you can get supplements.
Yeah, but it's not as good as the daylight.
No, I know, but everybody's different, and everybody has to source what they need from whatever's most appropriate for them.
Yeah, but I think the daylight itself is much better than dietary supplements. You know, so.
So we do need to touch on the impact of COVID. And there's a lot of people said, you know, a significant amount of people feel that the pandemic has made their symptoms worse. However, the flip side is, for people who were able to work from home, they felt better able to manage their symptoms. So another session that I ran, which included employees sharing their stories, very bravely, I thought. And one of the, it was their health and wellbeing lead. She talked about during COVID, her periods had become really heavy, very irregular, subject to flooding, to the extent where she couldn't leave the house for more than an hour at a time because she would bleed through her clothes. So the upside, we couldn't leave our houses for more than an hour at a time during lockdown 1, so that suited her fine. But didn't know what she would have done if she was expected to commute, sit through long meetings, walk around a lot, not get to the bathroom when she really, really needed to. So if you still have staff who are reluctant to come out, to return to pre-COVID working environments, have that on your mental checklist as one of the reasons why it could be to do with menopause. So these stats are always really interesting, and you know, they help to build the business case. But actually, I think what changes things fastest are the stories that we hear. And I just want to share a few quotes with you. And if you just roll through there's 3 slides, let people read them themselves. Somebody recently described their brain fog to me as, you know, when your computer gets that kind of spinning wheel. So it's like that's what happens. Your brain just kind of gets stuck, and you've got no choice but to wait it out or do a reset or a reboot like you would with a hardware. The good news is it doesn't have to be like that. And there are choices for managing symptoms, both from an individual perspective and workplace. So we're going to touch on the personal. I go into this a lot more detail on more kind of general sessions, but I just want to make you aware of what the options are today. So first of all, HRT, hormone replacement therapy, had a lot of bad press in the past, but what we now know is that for the majority of people, not everybody, but for the majority of people, the benefits will outweigh the risks. And that's not just in terms of managing those shorter term symptoms, like the night sweats and the brain fog and the anxiety and the achy joints and the palpitations and the itchy skin, or you know, whatever it is that you've got going on, but also helping to manage the longer term impact of estrogen levels, particularly on brain health, heart health, and bone health, particularly thinking about osteoporosis. Anyone seeking HRT needs to speak to a specialist, not ask in a Facebook group or Google it, or you know, read whatever the Daily Mail online is saying on about it at the moment. Need to talk to a specialist. First line of specialist is going to be GPs, and therefore NICE guidelines are the things to read ahead of any meeting with a GP. NICE guidelines for menopause, patient guide, doctor guidelines, giving you an idea of what your GP should be discussing with you. So education levels amongst GPs about menopause aren't as good as they could be. That is being addressed. But in the meantime, what it means is that people seeking advice from a GP need to really educate themselves ahead of that appointment. And what that means for you as managers is that people might go and see the GP and not get what they need on the first visit, or the second even, or sometimes even the third, depending on the level of care where they work. The other thing about HRT is that there's a shortage, which I'm sure you've heard about in the UK at the moment, particularly of the estrogel, which is the estrogen that's rubbed straight into the skin. And that's, I spoke to a specialist a couple of weeks ago, and she reckoned that it would last until the end of this year. So what that means is that a lot of stress amongst people who are using HRT. Either their prescription is running out and they can't get it replaced, they're having to reduce their dosage, so symptoms are reappearing, or they're having to swap to an alternative HRT, potentially to the spray, which is now running low too, because more people are looking out for that. So there's all this fear and extra anxiety around accessing support, medical support for HRT.
Is it a problem because of the pandemic supplies, or is it
It's Brexit. It's always, there's a few different things, but it's an increased demand is part of it. Is one of the key reasons. So supply can't keep up with the increasing demand around HRT as education levels about menopause are improving and more people feel safer and more comfortable accessing HRT, and GP education levels improving as well. Now, HRT isn't for everyone. Not everybody can take it. You know, there are some people who can't take it, and not everybody wants to take it either, in which case you do need to look at lifestyle choices, which can be equally effective. And it's really about managing stress. You know, and we tend to think of stress as being external, pandemics, overseas conflicts, cancelled holiday flights, difficult children, aging parents, poorly pets, you know, whatever it is that's stressing you out right now. But actually, stress is internal too. And our bodies become stressed out by what we eat, what we drink, and the way in which we exercise. So the headlines on this are the key triggers for menopause symptoms are alcohol, caffeine, sugar, dairy, red meat, gluten. I know. So the last thing you want to hear, right, when you can't sleep, you're really anxious, you're a bit tearful, you're a bit grumpy, is, well, actually, you've had less coffee, wine, and a cake, you might start to feel a bit better. So, you know, neither of the choices are easy, whether you're looking at going down the HRT route or looking at lifestyle changes. They're both difficult. So it's not an easy choice to make for people. Okay, so quick quiz. Can you remember what was the average age for menopause? That's right, 51. But all that is about is the time periods of stop. So again, any article you read about menopause, as well as having the lady fanning herself, it will also talk about the average age for menopause being 51. But it's very misleading because symptoms typically present in early to mid-40s for most people. That's far more common. Might also be interested to know that back in the 1900s, average age for menopause was 57. Life expectancy, 59. So, you know, menopause, the least of our worries, really. Whereas now, average age for menopause, 51. Life expectancy, 81. So 30 years, at least, to learn to live and manage with these lower levels of hormones. Could a 28-year-old woman experience menopause symptoms? Oops. Yes, she could. So that's 1 in 1,000 people under the age of 30 experiencing an early menopause. And in fact, another session I ran where employees were sharing their stories, one of the employees was a 28-year-old woman and talking about the impact that an early menopause has had on her relationship with her boyfriend, pretty much ended it. Her friendship group, who obviously had completely different ideas about what was going on in their lives at the time than what she was trying to cope with, and then the impact that had had on her at work as well. 47-year-old trans man, could he experience menopause symptoms? Yes, absolutely. May well still have womb and ovaries intact. And actually, a few months ago, I read an article written by a trans man. He was talking about periods rather than menopause, but what he talked about was how difficult it was in bathrooms where there was no sanitary products provided. I mean, we don't always get those in female bathrooms either. But what there also wasn't was any sanitary disposal units. So very difficult for him. So again, just something to be aware of as a manager, if you have trans colleagues in your team, about additional difficulties that they might be going through that you're not aware of. What else have we got? What were the 3 protected characteristics that are relevant for menopause in the workplace when it comes to employment tribunals? That's right. Remembering that disability is, menopause is not a disability. It meets the definition under the Act in terms of the day-to-day effect on, the impact on day-to-day activities. Okay, great. Thank you very much. So what about menopause at an organisational level? So in my experience, these are the 6 key areas that you should be thinking about. And what I'm going to do is try and sort of talk about it from a management aspect. So first of all, assess. Metrics matter, right? What we don't measure, how do we know if it's working or not? So as a manager, are there any common themes that are coming out in conversations that you're having? Are there particular symptoms that seem to crop up more in a particular environment or a particular role? Are there adjustments that have been put in place that seem to work better than others? So look out for themes that are coming up in conversations, and create a log between you so you can all access the same information without breaking confidentiality, obviously, but keep themes. Engagement, as I've said a few times now, the quickest way for generating engagement is by sharing stories. So if you have a story and you're comfortable sharing it, then do so, whether that's on a one-to-one basis, writing a short article, recording a quick video, however you feel comfortable doing so. But if you have an experience that you're comfortable sharing, then do that. And equally, provide a platform for the people that you work with to share their experiences if they choose to as well, whether that's on a team stream, a private forum, informal menopause meetups. But letting people talk about their experiences really helps to create those ripples of menopause conversations throughout the organisation. Awareness for everybody. I can't emphasise enough how important it is to invite everybody into the conversation. So a reminder that we've got that Men and Menopause session on the 5th of August. Because there's a lot of, the comparison I used earlier was around mental health. Everybody is included in the mental health conversation, regardless of your mental health. And there's a lot of synergy between mental health and menopause with regards to the perceived stigma and people worrying about the kind of language it's okay or not okay to use. 10 years ago, we wouldn't have considered talking about mental health in the workplace, whereas now it's much more commonplace, and menopause is coming fast on the heels. Yeah.
Yeah, so I just want to say, I'm co-chair of our Women's Staff Network.
Oh, you great.
Which we do also have some, men that have joined as well, and a lot of them have said one of our key objective priorities is menopause in the workplace.
Great.
As well as the menstrual cycle, because
Yeah.
it's also, another issue. But a lot of them have said they would like to have more information on how to cope with their partners going through menopause, or
Yep.
they can see the changes coming and they're not talking with their partners, and it's definitely something that it needs to be inclusive of everybody.
Absolutely, and I'm running more and more men-only sessions over the last 18 months. Because I think it's a myth that men don't want to be involved in the conversation. Quite often they think that they're not going to be welcomed, or they're worrying about saying the wrong thing, or they're going to prevent people going through menopause sharing their experiences. But actually, if you are living with someone, like we said, who's not sleeping, that's going to have a massive impact on you too. Another example, I ran general awareness session, mixed group, 3 guys sitting in the corner in the front on a desk by themselves, and hadn't known each other before the session. But what they discovered throughout the session that we ran was that each of them was there because their relationships had been heavily impacted by menopause. And in fact, in one of those cases, he'd actually separated from his partner. And what they went on to do was to set up a men-only support group for menopause. So it's really important that it's an inclusive conversation, but actually sometimes you do need to have these kind of separate psychologically safe spaces, almost like you were talking about earlier with trying to give the lady access to the vitamin D earlier. You need these psychologically safe spaces for people to talk to so that they're more comfortable when we bring everybody together. So providing that support to everyone, extending support beyond the person experiencing menopause, and recognising those differences again, that if you're in a same-sex relationship, then your experience of menopause within a same-sex relationship is probably going to be very different from your experience of menopause where you've got where you've got a male and female. So think broadly all the time. Educate is around you guys really as managers, making sure you're up to speed on the subject matter, make sure you're up to speed on the latest legislation so you don't get an employment tribunal landing in your lap. Making sure that you do recognise the topic as an inclusive, it's intersectional, using the right language. Try to talk about people going through menopause, so you're not unintentionally excluding people who experience menopause but don't identify as female. Or you can use gender additive language. So I'm working with Health Education England, and all their documents are set up to talk about women and people going through menopause. So choose the language that you're going to use, but make sure that it's going to include everyone within that conversation. And the final piece around Involve is a reminder that this is, whilst menopause is literally a hot topic right now, and you know it's trending, it's here to stay. We will all still be menopausal in January next year and the following January too. This isn't a one-off, nice to have wellbeing initiative. Menopause conversations need to be embedded for the long term. And one of the trends I think we will start to see as it becomes more commonplace is looking at social and community impact too. So if you have people working with you who may be within their community, topics like menopause simply aren't discussed, work might be the only place where they can talk about it and get access. Next slide, please. Now, do not think that it's all about you, that you have to take responsibility for everything. Everybody has a role to play when it comes to getting menopause support in the workplace, right from the top of the organisation, outlining their approach, whether that's in the form of a policy or guidance document, down to employees who ultimately are responsible for their own health. But in terms of what your role looks like, your role and responsibilities, if we move on to the next slide, there's a few things to consider. So first of all, see, I can't read what I've got on my pieces of paper here. There we go. Thank you. That's better. So simply being open to conversation. You know, if someone wants to talk to you about menopause, you're not going to kind of avoid that conversation or try to push them off in another direction. Be open to listening. You're there to support and signpost and consider reasonable adjustments, and we'll look at what some of those adjustments might be shortly. Familiarise yourself with related policies within the workplace, whether that's flexible working or mental health policies or other similar guidances, risk assessments, things like that. And promote a menopause inclusive environment. And that can actually be quite simple. You know, just letting your team know that you've attended this session today is letting them know that you're open to conversation and letting them know that menopause is an inclusive topic for you in the workplace. Now, what you shouldn't be doing is making assumptions. Just because somebody is a particular gender or a particular age and their behaviour has changed, it doesn't mean that menopause is the reason. You know, we never really know what's going on in somebody's life until they've chosen to share that with us. And don't worry, you are not expected to be an expert in menopause, any more than you expected to be an expert in bereavement, divorce, long COVID, dyslexia, diabetes, you know, anything else that your teams may be going through that is impacting them at work. You don't need to be an expert, you just need to have a conversation about it, be able to review working conditions and signpost and support. You all happy with that, with those? Yeah? So I'm just going to let you look at that slide for a minute because there's quite a lot on there. What I would like you to notice is that sometimes you're leveraging what's already in place. You know, if you have an employee assistance program, if you have mental first aiders or occupational health specialists or employee networks that you can refer people to. Otherwise, you are looking at things like, is flexible working an option? And it's not for every role, but is it an option? You know, can people take regular breaks? Or is there the kind of cultures fallen into place where everyone's kind of sat at their desk, and if somebody isn't at their desk or they're away from their post, it's like, oh, where'd they gone? Or if somebody's on a very busy shift, you know, how easy is it for them to get to the bathroom when they need to? So think about all those things. So these are important, but they're very general. I think what makes a bigger difference, if we have a look at the next slide, is making sure that you're providing ongoing opportunities for people to discuss what's going on with them. You know, they're one-on-one conversations, and it's a series of conversations as well. It's not going to be resolved in one meeting. Multiple points of contact. You know, some people, for whatever reason, just will not want to speak to their manager about menopause. You know, we've all had a manager at some point where we just didn't get on with them for whatever reason. You don't want to talk to them about a particular topic, so who else could they talk to instead? So let your team know that there are other sources that they could reach out to. The menopause meetups, which I think I might have touched on earlier, informal meetups where people just get together and talk about what's going on with them, how they're feeling, what's working, what isn't working, and empowering staff to do that themselves. It's not something that you have to organise. Practical work strategies. Looking at whether that's modified duties, changing hours, making sure people do get regular breaks, are there extra resources available, are there deadlines that can be extended? So practical work strategies related to that person's particular role. A lot of the general reasonable adjustments we see talked about when it comes to menopause aren't suitable for firefighters or ambulance staff or police frontline workers. They're very much focused on people who work in offices. So they've got to be very role specific, and that's why it all comes about as conversations. And transparent absence reporting. So I don't know whether you have menopause as a drop down on your absence reporting, but if you do, it's something to consider, seeing if it can be added. Because first of all, it's a way of collecting data. How many days are being lost to menopause. But secondly, when people start using that reason, you've created this environment where people think, yeah, it's okay for me to say menopause is the reason I'm not in work today, as opposed to I've got a bad stomach or a headache or, just kind of fudging the issue. So it's about communication and transparency. If you do think you need to speak to a member of staff about menopause, how do you go about doing that? So first of all, it might sound obvious, but allow time. It's not a conversation that should be squeezed onto the end of another meeting or had in a corridor. 30 clear minutes in somebody's diary where that you're not going to be overheard and you won't be interrupted. Don't try and wing it. Do your homework ahead of the meeting. Check if you've already got any menopause policies or guidance in place that you can refer to. Encourage conversation. So how do you start that conversation? What you don't do is start off by talking about menopause. You can't out someone because they're menopausal. And if someone doesn't want to disclose that they're menopausal, they absolutely don't have to either. So what you want to be doing is talking about what you've seen has changed and giving them the opportunity to provide an explanation. So for example, you always used to be very early to all your shifts, but actually recently I've noticed you've been coming in late. Is there something going on? We always used to get really great feedback around you. That's changed slightly. Is there something going on? So comment on what you've seen has changed and give them the opportunity to explain. Actively listen in case it isn't menopause. Like I said earlier, don't make assumptions. And then explore solutions together. Whether they've not confessed, that is the wrong word. Whether they have said they are menopausal or not, you can still look at solutions. Okay, so if bad sleep is what's the trouble, is what's causing the trouble and impacting you at work, what can we do about your working day or your working shift to manage that? So explore solutions together, agree actions in that meeting and in writing afterwards. You know what it's like when you're in a meeting, and sometimes there's only two of you and you've both gone away and heard something completely different. So make sure you confirm in writing what you've agreed, particularly if there are adjustments, how long are they going to be in place for, and when will they be reviewed? And then in that review meeting, is the adjustment working? If it is, how long can you continue with it for? And if it isn't, what can you try instead? But keep those follow-ups in the diary and consider that also potentially you might need to refer to occupational health. Everybody happy with that? Yeah? Okay. All right, so we're drawing to a close now. And what I want really is a bit of accountability from everybody about the one thing that you're going to do as a result of what you've heard here today to get the menopause conversation going within your team, within the environment that you're working in. So are you going to let your team know that you attended this session? Are you going to encourage some of your male colleagues to attend the session in August? Are you maybe going to share an experience? Okay, so if we just skip to the last slide, and this is how I finish all my workshops. Next one, with a challenge. And my challenge to you is to have at least one conversation about menopause, and this includes you three at the front, every day for the next 7 days, right? And that could be at home or at work, One conversation a day, every day for the next 7 days about menopause. Give me a wave if you're going to do that. Yay. Brilliant. Thank you. So, that's the only way we're going to change things and normalise and socialise the topic is by talking about it more. So thanks very much, everybody. I've really enjoyed delivering the session today, and thank you for your attendance and participation too. Thank you.